Assalamu alaikum wa rahmatullahi wa barakatuh. Very good evening and welcome to another edition of Health Matters. I'm Khawa Solomon, so please do stay with us via the World Wide Web or channel 347 as you're watching now on DSTV. And ITV Networks.tv is where you can live stream right now. You can also catch our repeats tomorrow and on Sunday again. Please note that the shows are uploaded on YouTube on a regular basis, so please do follow ITV Networks Health Matters. So, unprecedented circumstances we find ourselves in, and the topic of discussion on all health related shows is COVID-19, and that's exactly what we're going to be talking about, what we're going to be sticking to for the rest of the evening. Please note I will not be taking any live calls for tonight, although there is a WhatsApp line which we will open in the next segment, inshallah, and you can send through your COVID-19 questions through to our specialists. We welcome them, Dr. Shuaib Body, representing the IMA, our nephrologist, resident doctor, and the list goes on. Shukran so much for your time. And we have Professor Shabir Mahdi. Shukran so much, Executive Director for the NICD, who is very much in the news today, and your whole long list of CVs, which we will get to in a minute. Vaccine Preventable Disease, Professor of Vaccinology, and the list goes on. So we appreciate your time on this short notice. As you know, things are happening as they go. So Jazakallah for both your time, and I think very importantly, the IMA has called for a unity and to stand all together in this fight against COVID-19. So firstly, if we could start with you, Dr. Shuaib Wadi, on what the IMA stance is with regards to COVID-19 and the community.
So, Assalamu alaikum wa rahmatullahi wa barakatuh. So, as you know, we are living through an unprecedented event. We're living through an event which nobody really has seen in their lives before. We do understand that over the past 2 weeks there has been a lot of disagreements around many issues in the community, whether the masjid should stay open, what people should be doing, what the response to this virus should be. We know that right at the beginning people were saying it's just another flu, this is something which is going to blow past us, and as time has gone the seriousness of this event has become more and more apparent. So we really, as the IMA, feel that as a community in South Africa, as the people of South Africa, we really are facing a major challenge. We know we're in a vulnerable country. We know that the challenges we face are huge, and we can only achieve success against this virus. We can only get through this situation if we do it together. If every sector of community comes together, every religion, every race, every part of society, from government to civil society to people working in every sector of society, needs to play their part. Whether it means, your part means staying at home because you need to stay at home to prevent the spread of the disease, or being someone on the front line of treating people with COVID-19. So everybody needs to identify what their role is, what they can do, what they can offer, and play their part and be united.
Absolutely. Jazakallah, Dr. Shuaib, for that. Professor Shabir, let's look at the latest facts that we must know with regards to coronavirus. What is the updates on COVID-19?
Right. So I think where we stand at the moment is there's been an exponential increase in certain places of the world. But at the same time, I think we need to recognize some of the successes which have actually occurred. In terms of at least 2 countries being able to control what were really large outbreaks, and that was obviously China, where Wuhan was the place that this epidemic actually sort of started off, as well as South Korea. So what the examples from those 2 countries and the lessons from those 2 countries tells us that we can actually contain this virus, provided that our approach to it is scientific and well thought out. And I think that's important. So whilst there has been an exponential increase in the number of cases, and certainly in some countries such as Italy, they're much more heavily affected. The percentage of people that are dying after they become ill are much higher, and there's a number of reasons for that. There is hope, and I think that's an important thing, that we need to understand there is hope. The South African government has been really proactive in terms of the manner in which it is approaching this particular problem. But at the same time, unfortunately, what we're seeing in South Africa is, despite what we see as an exponential increase, almost 540 cases now, the reality is that 540 cases probably doesn't represent the total number of individuals that have already been infected in this country. It probably only represents about 1/10 of the true number of cases. But that is no different from any other country where they've got sort of fairly restrictive criteria in terms of which individuals have been tested for COVID-19 up to now. So as we find that testing becomes more available, we shouldn't be surprised when we see those numbers really jump up even further. What's happening at the moment in South Africa is that the numbers of cases that are actually being confirmed is doubling every 2 to 3 days. So in 3 days from now, we can probably expect that number to go up to 1,000, right? And that number might even go higher than 1,000 if more people start coming forward to be tested. But having said that, I think there's some other realities that we need to also accept, and that is, this is a novel virus, right? We're still learning about how to go about treating the virus. We're learning how to go about to try to contain the virus to limit this sort of circulation in the community. So there are a number of lessons that we still need to learn. But people need to, whilst it's correct to be concerned, right? We also need to realize that not everyone that's going to become infected with this virus is going to have a poor outcome.
Okay.
Right. And I think that's something that's really important. So of 100 people that will be exposed to the virus in the general community, not if you got someone living in your household, right? Out of every 100 people, there's roughly about 1 to 2% of people that will actually become infected.
Okay.
Right. But the problem with those 1 to 2%, if we don't identify them early enough, they're still going to be in the community and they're going to infect other people. Right. So where we're reaching at the stage where we're reaching in terms of what the response should be to what's occurring in South Africa is that people need to start becoming much more aware in terms of whether they're manifesting any sort of signs and symptoms which might be associated with COVID-19.
Okay. Anything else?
And if that is the case, what's going to need to happen now is that we're going to need to have more people come forward to be tested, because once a person test has been positive, right, it's necessary for that person to go into isolation, and then the context of that individual needs to go under what we call quarantine.
So I'm going to jump straight to the symptoms, and if you represent flu-like symptoms, does that now mean that you need to go have yourself tested? On the testing, what does it cost? What is the timeline? Can test show a false negative? Another question that came in is, in what circumstance would someone need to be retested? And lastly, what to do if the test is positive?
Okay, so that's a lot of
questions.
I
know. We'll go through
so
that
we'll need to
one
go
by one.
by one.
Let's break it down, yeah.
So,
okay.
So what are the symptoms?
Flu-like symptoms.
So
do you
flu-like
need to have
symptoms,
this?
right? And so now the initial presentation of COVID-19 is very non-specific. It's very similar to any other viral infection that one would actually experience almost year on year.
Okay.
Be you an adult or be you a child. But I think what people probably the most important symptoms to look out for, right, is a fever, a cough, and probably headache, malaise, right? A feeling of tiredness.
Is it a dry or wet cough?
It doesn't matter whether it's a dry or wet
Okay.
cough, right? But if a person has got a fever and those other respiratory symptoms, that person in the current context needs to be concerned as to whether they might or might not be infected, right? And for their own safety, it's important for them to present for testing.
And Shabir, would you say that's independent of whether they've been exposed to a known case or whether they've traveled? Because up to now, the NICD has been fairly restrictive in their criteria.
So I think that's very important. What's happened now in terms of the latest cases is that we've seen an increasing proportion of the cases that have been diagnosed as being individuals that have not had any history of travel and that have not actually been in contact with anyone that's traveled.
Okay.
Right. So previously the NICD were recommending fairly restrictive criteria in terms of who should be tested. But now that there is community circulation of the virus has been established, right, our threshold for who needs to be tested and when they should be tested needs to come down.
Okay.
Right. And that will allow us to better quantify the magnitude of the problem, but it's also important in terms of that individual, what needs to be done for that individual, as well as the context of that individual.
So where can you have yourself tested?
So the first question is, what does that person do while they're waiting for the result of the test?
Right. So I think that's important. Unfortunately, so the test that we do to confirm the infection is what we call a nasal swab. They take sort of almost like a cotton bud type of apparatus, put it at the back of the nose, and then they send that off for a test.
There was a picture of it going directly, like
Well,
literally
it doesn't go into your brain. It doesn't go into your brain. It
It's
just goes
almost to the
back
back of your head. So
goes
is
to
it
the back of-
halfway?
there's
Quite a lot of space before you hit the brain. though.
Okay.
So it goes to the back of your nose, and this sort of, it reaches some point of resistance.
Because it
what we
was
call
like,
a
do you
pharynx.
want to experience this? And it was a cotton bud going almost right up into the brain. Okay.
Yeah, it looks much scarier than it
Okay.
actually
It is,
is.
Okay.
But so that goes for a test. Now, ideally, that sort of a test result, we would want to get it within a 24-hour period, ideally. The reality at the moment, unfortunately, in South Africa is that there is a backlog in terms of the testing, and the capacity to actually do tests at scale is currently limited. And that is something which the Department of Health is actively working on, which the various laboratories are actively working on. So ideally, we want the test result within 24 hours. But as Dr. Wadi pointed out, if you don't get the result within 24 hours, what do you do?
Yeah.
Right? And what you need to do is you need to exercise precautions. Right? Those individuals that are symptomatic need to engage in what we call social distancing, and that is they don't come into contact with anyone, at least within a 2-meter space. If possible, right, they should actually be in a separate room all by their own until they get a result to confirm that they're actually negative. The context of that individual in that period of time also need to actually remain preferably in the same household if it's possible. Right? And the reason for that is that they might also be infected even if they don't have the symptoms during that period of time, up to about 14 days after exposure to someone that is sick. They might be what we call asymptomatic, so they wouldn't have signs of the infection, but they might be brewing the virus at the back of their noses as well.
Okay, so let's look at you said timeline. You said 24 hours is what you're looking at, and then where are they meant to be going for testing?
Well, where they should be going to testing, so there's a number of laboratories, designated laboratories that have been set up, and I think that's available on the website.
Okay.
In terms of where people can present for testing.
On NIC's website. We need to go for a quick break. When we come back, we will be taking some of your questions only via WhatsApp. Please, COVID-19, the reality of South Africa today. Back in a moment. Assalamu alaikum wa rahmatullah. Welcome back. A very good evening. Health Matters, COVID-19. Absolutely the conversation on everybody's tea table at home, and we're talking about social distancing, we're talking about staying at home, and those are all one of the few things that you can do to prevent the spread of this disease. Talking about prevention, another thing is something as simple as washing your hands. Take a look at this video, very informative prevention from COVID-19. Take a listen.
You know that the best way to prevent the spread of coronavirus is to wash your hands.
Wash your hands.
Wash your hands!
But why? It's because soap, regular soap, fancy honeysuckle soap, artisan peppermint soap, just any soap, absolutely annihilates viruses like the coronavirus. Here's how. This is what a virus like coronavirus looks like. It's a bit of material surrounded by a coating of proteins and fat. Viruses easily stick to places like your hands, but when you rinse your hands with just water, it rushes right over the virus. That's because that layer of fat makes the virus behave kind of like a drop of oil. You can see it happening in this demonstration. Oils are just liquid fats. What happens when you pour oil into water? It floats. It doesn't mix. But add soap, and suddenly that fatty oil dissolves into the water. That's because inside, soap has two-sided molecules. One end of the molecule is attracted to water, the other end to fat. So when the soap molecules come in contact with water and fat, these dual attractions literally pull the fat apart, surrounding the oil particles and dispersing them through the water. Let's go back to our coronavirus molecule with that layer of fat holding everything together. When it interacts with soap, bam, that fat gets pulled out by the soap. Soap literally pulls apart and demolishes these viruses. And then the water rinses the harmless leftover shards of virus down the drain. But, and you know where I'm going with this, it takes time for this effect to happen. 20 seconds to be specific. To show why, we ordered this lotion that mimics viruses and their fatty layers. It glows under a UV light. If you just rinse your hands under regular water, nothing comes off. If you wash with soap for just 5 seconds or 10 seconds, your hands are still covered. The virus is still there, able to get you and others sick. But 20 full seconds, now the soap is actually destroying the virus. Hand sanitizer works too because it's mostly alcohol, and alcohol works in a somewhat similar way to soap, breaking down that fatty layer. You need a high concentration of alcohol to make that work. The CDC recommends hand sanitizers with at least 60% alcohol. But even with 60% alcohol, the CDC recommends using soap if you can. If your hands are sweaty or dirty when you use the sanitizer, that can dilute it and diminish its effectiveness. As for soap, just any old soap works. You don't need soap marketed as antibacterial even. The FDA says skip it. There's no proof it's any more effective. Just be sure to wash your hands for 20 seconds. That's happy birthday twice.
Happy birthday, dear. I guess me.
Or the chorus to Lizzo's Truth Hurts.
Straight to my face.
Or Prince.
Raspberry beret.
Or Eminem.
Go, go, only got
Or even Dolly.
Jolene, Jolene, Jolene.
Just as long as it's 20 seconds. And you're using the ultimate virus annihilator.
So there you've seen it, proof that soap does kill COVID-19 in 20 seconds. Happy birthday twice, la ilaha illallah. Somebody also mentioned that. Let's talk about prevention and exactly what that video portrayed, Dr. Shoaib.
So, I mean, as we spoke about earlier, if we want to stop the spread of the disease, we need to prevent it moving from person to person.
Yeah.
And the virus is usually contained in droplets which come from your respiratory tract. So when you're coughing or someone is speaking, the virus particles are in those droplets. They're very tiny droplets, you won't see them. And then those droplets can linger in the air for a little while, but then they settle down on surfaces. And then somebody else touches those surfaces and picks up the virus, touches their mouth, touches their nose, touches their eyes, and the virus can get into their respiratory tract and then become established. So that's how these viruses spread. So the idea is then washing your hands, as you said, regularly washing your hands so that your hands are clean all the time. There's no viral particles on them. And maybe Shabir can go on and tell us whether you need masks and other things like that as well.
Yeah. So what about those people going for testing? They have symptoms and they need to go to different centers. Do they have to do some precautionary measures when it comes to wearing masks or gloves?
Yeah. So ideally, if someone is symptomatic, they need to try to avoid sort of spreading the droplets, as Shoaib mentioned. And the way to do that is to at least cover the mouth. The problem with masks right now in South Africa is that there is a shortage of masks.
In the
world.
world.
We don't want everyone in the world. So we don't want everyone running out to go and purchase masks. In fact, you won't even get masks at the scam any longer. So there is a problem. So how else can you do it? It's what we call cough ethic. In terms of probably just using something to cover your mouth, to cough into your elbow if you're going to cough. So try to avoid the spread of the droplet particles in your environment. Now, I think...
Or maybe just wear a scarf in your
wear
neck
a scarf and just
to
cover your
yourself.
face.
There we
Sure.
go.
Yeah, that would be good enough.
And then, of course, you need to dispose of that clothing.
And that's very important. So anytime clothing becomes contaminated because of your droplets, you're going to need to wash it.
Okay.
And you can just put it into boiling water and that would kill off the virus as well. Now, what should that person that's sick do? Like we mentioned, he needs to go to one of the dedicated facilities where they're offering laboratory testing. Ideally, those individuals, if they are going to see a doctor, they probably should phone in advance. So the doctor knows that there's an individual that's symptomatic that's coming to see them. And it probably is not absolutely necessary for people under this scenario to actually go and visit a doctor if they need to be tested. If they've got the symptoms, they might just be able to go straight to the laboratories and the designated facilities.
Because they're putting other people at risk.
Correct.
That's at
What
the
we're concerned about is them going into a doctor. There's other people with other sort of conditions that are in the same sort of clinic or whatever it might be, in the same practice, and they might end up infecting the other individuals. So we're trying to what we call social distancing. We're trying to avoid contact, especially if someone is symptomatic more so.
So you and Dr. Shoaib are not practicing social distancing because it's meant to be about a meter and a half apart.
2 meters.
2 meters. Okay.
But especially if you're symptomatic. I think for casual, if you're not symptomatic, even half a meter is probably fine. But if someone is sneezing and coughing, it should be at least 2 meters apart.
Okay. I must say, going to the mall and getting some meds or just, shopping at the local store, they have the necessary signs, but there are people, just this afternoon, my husband said, he was trying to tell this person behind him, listen, guys, he was literally behind him at, on his back. And people are not quite realizing. I actually stopped someone and said, listen, there's a lady in front of you. Can you not see? She's actually nervous, moving back and forth. But this guy's not realizing. He's on his phone.
So
and
I think
people are not
we're
realizing.
not used to that as part of our social etiquette. And people need to build it into their behavior. And some people take it much more seriously than others. So obviously, I don't think there's anything wrong in this time.
In fact, he said, no, I don't know.
To
so
tell
I said,
somebody,
there's signs all over you, around you.
So I think there's nothing wrong with telling somebody respectfully and politely,
Yes.
please can we keep a distance because we want to prevent getting each other sick.
Yes, and they are actually compliant. They said, "Oh, sorry, but we should not be afraid to talk out." So let's talk about the treatment. Any other symptoms we need to make mention of? The prevention, hygiene.
In terms of treatment, in terms of symptoms, I think one of the most concerning symptoms is when a person becomes short of breath.
Okay.
And that's a really concerning symptom. Under those circumstances, it's not about going to get tested. It's about actually going
to emergency.
to see a physician to actually be assessed
Okay.
as to whether they need to be hospitalized. Because our concern is obviously they're developing a pneumonia, and once you start developing a pneumonia, then we going
Take us
down
through some
a
of the
particular route.
protocol if they're going to see their physician, because many people saying stay in your car, call them out and say you there, or do you go into the surgery or the hospital?
Well, look, it's going to depend on the individual practice and where you're actually going. But ideally, I think if you're going to a physician, to your own physician, you're probably wanting to give them a heads up that I am ill and this is the symptoms, and the physician would need to decide how best to sort of manage that
Connect with
individual
you.
in terms of assessing the individual.
Okay, so some people are saying they find it, the testing is quite exorbitant. Where can they go for testing because they're not a private patient?
Look, unfortunately, the test in the private sector is anything between 900 and 1,400 rand, and it's not a cheap test. But there's the only test that's available. We probably could get a test. The private sector should be able to offer that test at about 500 rand, and I think that's something which we're working on at the moment.
So, I mean, Gift of the Givers in Johannesburg has set up a testing facility at the Dome together with some partners to try and reduce the cost of the test to 750 rand, so that's about the cheapest. And they've got doctors who are volunteering their time to help to acquire the specimen there. So obviously, because the part of the cost is if the personnel that's required to acquire to get the specimen and the equipment and so forth.
So let's look at self-isolation. How do we practice the self-isolation quarantine, especially since we will officially be on lockdown come Thursday evening, Thursday midnight?
So I mean, I think there's different concepts. The one is lockdown, which is a community-wide. Every individual in South Africa will need to be subject to that, and that's subject to the rules which the president announced yesterday that every person. So the default state is lockdown. Stay in your home, stay in place, don't leave. Don't leave your province. Don't go to your mum's house in rural KwaZulu-Natal, or don't go to Nelspruit or Hazy View, wherever. Stay in your area where you're living at present with the people.
Because there were some pictures going around on WhatsApp saying that the army's going to be deployed. They see them getting ready.
Yes,
so the necessary steps will.
I think part of that is obviously to make sure that people comply with the lockdown, and part of it maybe to help to support the healthcare services and so forth and so on. So I don't want to speculate about that.
Okay.
So that's the default. There are exceptions to this default. There are people who would be allowed to go out. Obviously, everybody would be allowed to go out to get food and to get essential medical care. So if you are sick, you can go to the hospital. You can go to your medical practitioner. If you need to get food, you can go to your supermarket, to your grocery stores. You need to get medicines, you can go to your pharmacies. And obviously those businesses will have to be kept open. And then the other exceptions are for people who are running the basic and essential services which keep society working, those who keep the lights on, the water running, who keep the streets clean, who keep the your sanitation going to make sure that your garbage is emptied regularly. So those type of things need to keep going, otherwise they create other social and economic problems.
And there will be a list available on the government's website as well.
So I think it's just important to understand why we're having a lockdown, and that's really the important part. So the lockdown itself is not going to get rid of the virus.
Yeah.
Okay, a lockdown is a strategy which we're undertaking to try to contain the spread of the virus in the community. But that itself only works, right, if individuals that are sick during the period of the lockdown are actually coming forward to be investigated for an infection.
Okay.
Because we can identify the individuals in a more confined space, right, isolate them, and basically put their contacts in what we call quarantine. Right, so a lockdown is only going to work if we actually couple it with enforced actual lockdown, so prevent the social movement of people, but importantly to couple it with the testing of individuals that are symptomatic that might be shedding the virus.
Okay.
Right, so that's an important component.
We
of
don't
the
want them to
lockdown.
be spreading it to their own family members.
Absolutely. So this is all about containing the virus. It has happened in a few other countries as well, where we see the rise in the spread literally doubling, as Prof. Shabir mentioned. But we'll take more of COVID-19 information from our specialists in studio and some of your questions. Please do stay tuned. Assalamu alaikum, very good evening, welcome back. If you've missed this or any of the shows, please follow our ITV Network's YouTube channel, and there are repeats which will be tomorrow and Sunday morning as well. Welcome back. We're talking COVID-19, the reality here in South Africa, with Professor Shabir Mahdi, ex-executive director for the NICD, and IMA specialist, Dr. Shuaib Wadi. Okay, before the break, we spoke about lockdown. So before we continue that conversation, let's just take a watch at this 10 things that you can do during lockdown.
Here are the top 10 things you can do if you think you might have coronavirus or COVID-19. 1. Stay home. 2. Monitor your symptoms carefully. If they worsen, call your healthcare provider. 3. Rest and stay hydrated. 4. If you have a medical appointment, call ahead and let them know you may have COVID-19. 5. If your symptoms are severe, call 911. 6. Cover your cough and sneezes. 7. Wash your hands often. 8. Stay away from others in your home. Use a separate bathroom. 9. Avoid sharing personal items. And 10. Clean all surfaces that are touched often. For more information on COVID-19, visit cdc.gov/COVID-19. Let's take care of ourselves and each other.
So practice safe distancing, social distancing, 1.5 meters. And if you think somebody does have the symptom, or you do, please stay away from people at least 2 meters apart. So coming back to the lockdown and understanding, what we need to do, self-isolation, the clothes that we are wearing, the space that we are in. Is it true that everything that is within our space, we've got symptoms, we're possibly even positive, nothing that we touch or that we've used in that room leaves that room again?
Well, what needs to happen is that you need to clean the room.
Okay.
So you need to use some sort of a detergent and clean the surfaces. So what we know about this virus is that after a person sneezes, the virus might actually remain airborne. And it can survive up to about 3 to 4 hours. Once its droplets actually sort of land on a surface, it can survive on a surface for anything between 24 and 72 hours, depending on the type of surface. So as an example, glass surface, probably up to about 2 days, 48 hours.
Sure.
So in the environment where an individual is that has been coughing, that environment needs to be what we call decontaminated. Use some sort of a detergent to basically cleanse that environment
And is
on
it
a regular
correct
basis.
bleach or Dettol
Bleach
diluted?
That's more than adequate.
Okay.
Yeah.
And wash the clothing. And
Yourself.
wash the linen and
Okay.
so forth. And so on.
So Dr. Wadi, to you, I want to find out about your immune system. There's been messages and people asking about, do we now need to take vitamin C? Elenia was on last week and she said, if you're going to do vitamin C, do it in its rawest form. There's vitamin D, people talking turmeric, home remedies, garlic, ginger, black seed.
So I mean, at the moment, what we know is that the majority of people will get better. Okay. The majority of people will have mild disease and get better, and that's because even though this is a novel novel virus, if you've got a normal, healthy immune system, for most people, it should be able to destroy the virus, and then you acquire some type of immunity against the virus. But your immune system is very intelligent. There are parts of your immune system which are non-specific, like a wall, like a border fence. They don't care whether it's an elephant or a dog or a cat, whatever. It will stop everybody from jumping over that border fence, like your skin, okay? But there are other parts of your immune system which are trained. They're going to only attack certain enemies. That's called learned immunity. Okay. And that's much, much more efficient. It's going to know exactly, for example, if measles comes in, if mumps comes in, if TB comes in, it's going to learn that that's what it is. And it's got specific soldiers which are going to attack that. And that's what vaccination does. It trains those specific soldiers, so it trains your acquired immunity, your specific immunity. Now, we don't have specific immunity against this virus because we haven't seen it before, humanity hasn't seen it before. That's why it spread so quickly, that's why so many people are affected. But having said that, some people can acquire that immunity quite rapidly, and then they can control the virus so that it doesn't kill them. It doesn't spread into their lungs, doesn't cause severe pneumonia, and that's the majority of people. So there are some things which you can do, obviously, to make sure that your immune system is strong. If you're less stressed out, if you're exercising, if you're generally healthy, if you're getting enough sleep, if you're well hydrated, those things will promote a good immune system. If you have a chronic illness, like diabetes, like hypertension, your immune system may be debilitated. If you are very stressed out all the time, your immune system may be debilitated. If you have nutritional deficiencies, your immune system may be debilitated. If you're on medication, and there's certain specific medicines which people use because we're treating immunological diseases, that's going to affect your immune system's ability to deal with this illness. And obviously, if you have a disease like HIV, which specifically targets the immune system, then you may have a serious problem. And maybe Shabir, that's really his forte. He can tell us
so
some
are
more
you
about that.
saying that in effect, those with chronic illnesses just needs to stick to their meds, healthy diet, what the doctor says, and those that are not, do they continue, do the boosters of immune system? Is it going to matter?
Yeah, look, I think the bottom line is that if you've got a balanced diet, there really isn't much need to take vitamin C or vitamin D or whatever other vitamins. You need to have a balanced diet, and you need to lead a healthy life, as Shoaib mentioned. In terms of what else can you do, so the reality, and Shoaib, I think this is an important point to point out, is that 50% of people, just over 50% of people that are going to become infected with this virus are going to be completely asymptomatic. They will never know
They won't feel a thing.
that they've actually been infected. Right?
Will they know later?
We might be able to
Only
do a
to
blood
test
test
them.
later. Yeah, we might be able to do a blood test to find out if they were infected or not. But those are not an important group of people. What's happened in that group of people, they've been infected, their body has been able to mount an immune response, they've been able to clear the infection very efficiently. Now, of the people that become symptomatic, they start having a cough, a fever, etc., 85 to 90% of that people are going to be mildly ill. Right? They're not going to need anything more than Panado, as an example, to recover from that. So there's no problem. It's the 10 to 15% of people who are especially individuals that have got these comorbidities, the diabetics, hypertensive, people over the age of 65, especially over the age of 70. That is a group of people that are more likely to develop severe disease, to end up in hospital, and unfortunately, they got a higher risk of actually dying. Right? And it's that group of individuals that we're particularly concerned about. So how does this relate in terms of what happens at a household level? Right now, those are individuals that definitely, right, should be practicing social distancing. Those are the individuals that definitely should be avoiding anyone else that is coughing in a household. Those are the individuals that need to take heightened precautions in terms of minimizing their risk to becoming infected. And it's really that group that we're really concerned about. Children, we're not that concerned about, fortunately. Right? And the reason for it is that even children are as equally likely as an adult to get infected. If there's someone in a household that's infected, right, the chances of actually developing severe disease is very small, and there's very, very few children that have died. In fact, the only children that have died are those that, again, have had comorbidities. The majority of children that have died are those with comorbidities.
Shabir, would you say that that's maybe because children, almost every virus they're meeting is new, and they have an agile immune system which is built to deal with these new viruses all the time?
Yeah, so we're not too sure what the reason for it is, because there are some viruses that affect children much more severely than adults. There's another virus called RSV, which is circulating at the moment. So if a child is coughing right now, today, he most likely is infected with RSV and not coronavirus. But children tend to be more severely affected by that virus compared to adults. So we're not too sure exactly what it is that's sort of protecting children from developing severe disease from the coronavirus.
So from WhatsApp, we've got a question on herd immunity.
Okay. So herd immunity, so when we talk about herd immunity, we mean that if you have 100 people and a significant number of those people have been infected and have been have cleared the virus and have managed to develop immunity, it interrupts the ability of the virus to spread in the community. So you understand what I'm saying? So it's a thing which we commonly talk about in vaccinology, so I'm going to let Shabir talk about that.
Yes, so I think Shoaib has pointed it out. So measles is a good example, right? That if you can get 95 to 98% of the population vaccinated against measles, right? the ability of the virus to actually transmit from one person to another very successfully is diminished. In fact, it almost disappears.
Okay.
But if only 40 or 50% of the population are immunized against measles, when one case of measles occurs in a community, that individual can infect up to 13 to up to about 18 other people just from a single case. Now, with coronavirus, we're fortunate in that it's not as contagious as measles.
Okay.
Right? One individual is on average infecting about 2 to 3 other people. Right? So the level of people that need to be sort of what we call immune to be able for herd immunity to kick in probably is going to be much lower than the 90-95% that's required for measles. Right? But it's going to take time for the community to develop herd immunity. It means a significant proportion of the community, probably 50 to 60% of the community, would need to become infected with coronavirus before we start seeing herd immunity materialize for coronavirus.
Okay.
And that's a large number of people that are infected.
But just
unlikely to happen in a very short period of time.
Yes, absolutely. We talk more COVID-19 just after this, your questions. And there are some people, some sects, some religious organization that believe this is just a load of hogwash and you know, it's not the end of the world, or it's not this, it's not that. But we talk more seriously on COVID-19 and that just after this. Assalamu alaikum. Welcome back. A very good evening. This is Health Matters. Thank you for joining us and staying with us. Our last segment in the last few minutes where we could take your COVID-19 questions. Just before the break, we spoke about the elderly, those that are most at risk. So now to give you more information about that is the CDC. Take a listen.
Hi, I'm Dr. Jay Butler, Deputy Director for Infectious Diseases at CDC. I'd like to talk to you about the new virus that causes the disease COVID-19. Older adults and people who have severe chronic medical conditions like heart, lung, or kidney disease or diabetes may be at higher risk for severe illness from COVID-19. If you are one of the people at increased risk for serious COVID-19 illness, it's especially important for you to take action to reduce the risk of getting COVID-19 now. The first thing you can do is take care of your own health. Wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer with at least 60% alcohol if soap and water are not available. Cover your coughs or sneezes with a tissue, or cough or sneeze into your elbow, not your hands. Avoid contact with people who are sick. Clean and disinfect surfaces in your home, such as counters, tabletops, and doorknobs to remove germs. Use household cleaning sprays or wipes according to the label instructions. The next thing you can do is make a plan for what to do if you do get sick. Know who will take care of you if your caregiver gets sick. Talk to your healthcare provider about getting extra necessary medications to have on hand. Get enough supplies, too, including enough household items and groceries so you can stay home for a few weeks if you have to. The third thing you can do is pay attention to what's happening locally. If COVID-19 is spreading in your community, stay home as much as possible and avoid crowds. If you get sick with fever, cough, or shortness of breath, call your healthcare provider. If you develop warning signs, such as difficulty breathing, persistent pain or pressure in your chest, confusion, or blueness of the lips or face, these may be signs of serious illness. Call 911. For more information and the latest resources, please visit cdc.gov/COVID-19.
Welcome back. That was very important. And note that you can contact the government health department as well as the NICD. We have Executive Director for the NICD in studio with us, Professor Shabir, and Dr. Shuaib Wadi. Shukran so
don't
much.
call 911 in South
Yes,
Africa.
oh yes, I
please.
forgot that one. Don't call 911. We've got an 0800 number. We'll put that on the screen a little bit later. So again, those that are most at risk, pregnant women, comorbid diseases, lupus has come out. What do you say to them?
Well, not pregnant women. So fortunately, there isn't too much evidence at this stage that pregnant women are a risk group.
Okay.
The other groups, the elderly especially a risk group, and other conditions. And like we said, I mean, those individuals need to take extra precautions in terms of minimizing their exposure to individuals. Ideally, if they're living on their own, they shouldn't entertain visitors during this period of time when the virus is circulating. They obviously need to be supported in terms of their day-to-day living, but we just need to be sensible how we go about supporting those sort of individuals.
So again, about the testing, if you've tested negative, is there still potential you can carry the virus? Another one said that they actually traveled and they had flu-like symptoms and then actually got better. Did that mean they had COVID-19?
So we wouldn't know whether they had COVID-19 or not if they hadn't been tested.
It's certainly possible.
It's possible. It certainly is possible, and especially if they travel to one of those areas that's where the virus has been circulating in the community, highly likely.
So even if they traveled, so even if they traveled and they, even if they got better and they weren't tested.
The majority gets better, remember.
No, but can they still be tested for COVID-19 after they got better?
So there is a blood test that has been developed now to see whether someone has been infected or not, but it's not going to be of much use to that individual. So there's no need at this point in time for that individual to have the blood test done, and it's not currently available in South Africa.
Okay.
In terms of whether you've recovered or not, ideally what it would require is repeat testing. But as Shoya pointed out, it's an expensive test.
Yes.
And there is a shortage of tests. So at this stage, what we're recommending is that if someone has become asymptomatic, so the signs and symptoms have disappeared, they can consider themselves sort of cured. Ideally, those individuals should still stay away from other people for at least 14 days, or at least a week after they've become asymptomatic, just to make sure that they don't coincidentally end up infecting someone else.
So, of course, those with kidney disease and autoimmune disease like lupus, they follow the necessary guidelines like the CDC.
So I think there's a big question for many of those patients. They have to balance many aspects of their lives. Sometimes they may have to change aspects of their treatment. So, for example, patients on dialysis who need to leave their home to go for dialysis need to change the ways they get to dialysis, their transport schedules. Sometimes their dialysis schedules will change to spread them out so that they're not together with as many patients as possible. So there definitely will be changes. The video mentioned that people who have regular checkups with the doctors may need to do telephonic checkups. They may need to get more supply of medications. They may need to get supplies of food. But bear in mind, this is for sick people who can't go out regularly and who really should be going out much less. And as a community, we should be identifying, and as families, we should be identifying which individuals in our families are particularly susceptible and work out how to support them. How do I make sure that my mom doesn't have to leave the house for groceries? Maybe I can buy the groceries for a packet and then we can deliver it for her so she can get it. And then obviously you limit the interaction between yourself and your mom. Maybe you don't visit with all the kids every week.
No, there's no visiting.
So
there's
those are the type of things you need to, really need to do. We should have been doing that already for a couple of weeks
month ago
to try and limit
when we had Dr.
the risk
Kerrigan
of them getting it.
Okay, so given the high demand for testing and low availability of such tests, for someone with no symptoms who travelled recently, has come back to South Africa from a high-risk country, what do you recommend? Should they go and have themselves tested, no symptoms?
No, they shouldn't have themselves tested. What they should do is go into self-quarantine.
Okay.
So they shouldn't come into contact with other individuals, at least for a 14-day period. To ensure that they don't become symptomatic during that period. But there's probably little reason for them to be tested in the context of the reality that we've got a shortage of kits.
Okay.
And it's actually taking quite some time before those test results become available as well.
But if they get sick,
then
they need to be tested. And if they get
if
really
they show
sick,
symptoms,
they need to go to the hospital. Yeah.
Okay. And are the testings available at the public hospitals?
Unfortunately, on a very limited scale at this stage. And at this stage, again, they're just using the algorithm in terms of directing testing to individuals that are symptomatic, that have got a travel history, or that have been in contact with someone with a travel history. And they're expanding that slightly in terms of individuals that are admitted to the hospital with a cardiorespiratory illness, with pneumonia.
Okay. Fabric masks, does that protect you?
Well, the answer is
it's better than
probably
nothing.
not. So I think there isn't evidence. I think we need to just, about masks, like we said, there is a shortage of masks. The problem with fabric masks is that if you're going to use it, you need to use it consistently. You can't end up taking it off, putting it on, because the manner in which you handle the mask might actually increase your risk paradoxically of becoming infected because of the contamination. So it depends for what purpose you're using it. If you're using it because you're wanting to stop a sort of transmission of droplet spread, fine. If you're using it to protect yourself, there's little evidence to show that it actually protects you. Like we mentioned, The way you get infected is usually by self-inoculation. So you touch contaminated surfaces and then you end up wiping your face and you get the virus
That's how
into
you
your
get
body.
it because of the mask.
So
Okay.
if you touch yourself, touch the mask, put the mask on, there's a problem.
That's how you need to take it off. Okay, so if you're going out, you have to go out to the shop, buy bread, see the doctor, you're coming back. What are the rules around that? Undress you, take a shower, and put the clothes in the wash.
No, not if you're just going to the shop and back.
No, during lockdown or now during this time. Okay,
If you
guide us.
if you're treating someone who's ill, or you come across somebody who's ill, somebody who's coughing, who's symptomatic, those people shouldn't leave the house at all for anything. Other people need to support those people. So it's very important for people to know, if you know somebody who's infected or may be infected and is ill and is living on their own, you need to support that person. There are people like that. There are people whose families are living far away.
Yes.
So as a community, we need to identify, phone your friends, are you well?
Yeah.
Especially the people that you know are living alone. And because those people will be tempted to go out if they don't have support. And we really don't want those people to leave their home.
We've got 30 seconds to wrap up. Professor Shabir, your take-home message, safe websites where people can find the correct information.
Yeah, I think the important thing is to avoid social media at this point in time. I think the type of false information that's coming in social media is creating more panic than doing any good. So we just need to be careful in terms of what sort of information we consume and stick to what the scientists are telling it. I think the Department of Health has been very open in terms of what's happening, and we should believe them.
So, Dr. Wadi, from the IMA, what is your message to those still thinking this is some sort of conspiracy theory? We've got the higher power with us. We don't need protection.
So, I mean, everything comes from Allah subhanahu wa ta'ala. So I trust in Allah subhanahu wa ta'ala. Look, there's obviously this is a major challenge, but there are things you can do with your family. Maybe this is a blessing in disguise for some people. They can spend more time with their children, more time with the family, get to know them, talk about things that maybe you would not have spoken about. Don't divorce your wife. Now is not the time, because now
no place for you to.
There's nowhere for her to go. So, but look after each other, and it's also an opportunity to do good, to help other people in the society, and as Muslims to try and demonstrate the beauty of our religion and of our way of life in terms of being a mercy to mankind, in terms of being a boon to mankind, a help to the rest of humanity by being exemplary in your behavior. Set an example. We don't want to be the ones who are spreading infection, who are disobeying the commands of Allah subhanahu wa ta'ala, but also the commands or the orders of our local authorities. Try and adhere to the rules that have been set to you. And then obviously continue to make dua, make your salah, make istighfar, and turn to Allah subhanahu wa ta'ala for help.
Shukran so much, Dr. Shuaib Wadi and Professor Shabir, for their time. We appreciate as they update us on COVID-19. We'll do the same next week, same time, same place. Please follow us on our Twitter, Facebook, and YouTube channel. Remember, safe distance away from each other. If you have any symptoms, contact telephonically your local general practitioner, and we need to look after the elderly and those we see in informal settlements. Think of them as we not wanting to spread this COVID-19. All the best, lots of du'as, make istighfar. Wassalamu alaikum from myself, Hawa Solomon. Have a good evening.